just tell. Yeah, I am Dr. Sudhir Kumar. I am a consultant neurologist at Apollo Hospital in Jubilee Hills, Hyderabad. And I think today we had a very good session here with FICCI Ladies Organization. And I spoke on the neurological problems that we commonly see in women. And the first topic I spoke on was epilepsy or fits, where people get these convulsions and tend to become unconscious. It is more common in children or younger adolescents or adults. I think there are a lot of misconceptions. People believe that it is because of some devil or evil forces going inside the body, but it is not like that. It is because of a brain problem where there is abnormal discharges, and so they get epilepsy or fits. It can be easily treated. So when people take medicines on a regular basis, there is no problem. And also in our society there are a lot of stigmas. When a woman says that she has epilepsy, and if she tells this to the boys' party, they don't want to marry and things like that. So they have to hide the information. But actually it is not like that. It is not a problem at all. So if a woman has epilepsy and we give her medicines, she is going to have a normal married life. She can have normal pregnancies, and so there is no problem at all in the married life. So, but because of the misconception and stigma, they want to hide. So I think I want to say one thing is that we have to treat women with epilepsy just like any other woman and treat them with good medications. They can have a normal life. And second topic I spoke was brain stroke or paralysis, which is one of the three most common causes of disability and death. So other two are heart attack and cancer. And so stroke commonly leads to paralysis or weakness of one side, arm and leg. And the common risk factors in our people are sugar, high BP, cholesterol, obesity. So people who have these risk factors, they have a higher risk of getting brain stroke. And the important thing I want to say is that if somebody gets paralyzed, if they come to hospital in first 4 hours, there is a very good injection which can be given, and with that they can be cured. But if suppose we miss that 4 hours, then there is no medicine to treat the paralysis. Then takes a long time. Then we have to go for exercises, physiotherapy, speech therapy. So it's a long time, but still definitely we can look after them if we take care of all these helps. So I think the most important thing is to prevent the stroke. If we treat sugar, BP, cholesterol properly, avoid obesity and avoid smoking, then we can prevent a brain stroke. And the third thing I spoke on memory, and that is the memory problems and dementia. So in that, the normal memory, I want to highlight that it begins very early. So most of the learning and brain development happens in the first 2 years of life. So for a child it is important to have good 2 years, and then in the younger age. And also when people grow older, commonly we think that they have memory problems. But if they are healthy and normal, means suppose they don't have any problems with the brain, then we don't expect any memory problems even in old age. So even at 60, 65 they should have normal memory. But yes, occasional forgetfulness may happen, but not severe memory loss, which we see in a condition called dementia. So in dementia people have severe memory loss. They are not able to function normally. For that, if somebody has a dementia, then we have to find out the cause. There can be some causes like deficiency of vitamin B12. So if we can diagnose vitamin B12 deficiency, we can give them supplements, and with those food supplements and vitamin supplements they can improve. Sometimes it can be brain stroke. If it is lack of blood flow, we can treat that and they can get better. Another condition is called Alzheimer's disease, where it's a degenerative process. So for that there is no cure, but there are good medicines which can help them live better and improve the memory even in Alzheimer's disease also. See, the children memory and intelligence, it depends on the genes. So suppose parents have father and mother, they had high IQ and high memory, high learning power, children also will be bright. So mostly it is controlled by the genes. So genes alone is not enough. We have to use hard work and hard power working also. So even if somebody is very gifted and bright, unless they use the time efficiently, not like that. I think if they are brought up and grown normally, they won't have problems. But if suppose they are put under a lot of pressure because they are very bright children, then parents may want them to at 16 itself they want to do graduation. By 20 they want to do post graduation. Or if we put, or if the child may be interested in say painting and drawing, but we say no, you should become engineer. So if parents put lot of pressure which child doesn't want, then they can have problems. So but if the child is allowed to do what he wants, then they won't face problems. No, mostly in teenage and younger age, because after that they get their own independence. They don't have to listen to the parents or the teachers. So in the school age and the college period, that's the time these psychological problems are more common.